One of our colleagues was injured after the house of his neighbor was bombed, and he was bleeding, and his daughter told him, "But doctors don't bleed." Well, they do. In Gaza, they bleed open. I was in Gaza throughout November and December 2023. I was leading the team back into Gaza since the beginning of the war. We initially went to Khan Yunis and to Nasser Hospital, where our colleagues from Gaza had been setting up a surgical unit to try and support the hospital. Khan Yunis was already hosting an insanely high number of displaced from the north. So that's why we decided to focus on primary healthcare as well, supporting the Shohada Health Center, which is the biggest health center in Khan Yunis. The health center before the war was seeing about 200 outpatient consultations per day. In about a week, we were seeing 600 patients in our outpatient services. Half of them were children under the age of 5, coming for conditions such as diarrhea, respiratory tract infections, skin disease such as scabies, etc. All of these are very clear illustrations of the horrific living conditions that those people were left in. Just at the beginning of December, when the conflict moved very much to the south, the health center was ordered to evacuate. So we had to stop providing healthcare for these people. So all those 300 children that were under 5 that we were seeing every week no longer had access to healthcare. This is really part of the systematic destruction of healthcare that we're seeing in Gaza now. The staff have been working for over 100 days, non-stop, around the clock, 7 days a week, 24 hours a day. My colleagues were up in the operation theater until 1 a.m., 2 a.m. every day, non-stop for more than 3 months. They're beyond exhausted at this point. They come to the hospitals, they see horrific scenes, they see children really badly burned, badly injured, their entire face is burned, eyes are gone, babies with no legs anymore that you need to amputate. The weight that we put on the healthcare providers in Gaza is just, it's not something anybody can ever cope with. The mental health trauma of what is going on now in Gaza is beyond words. We hear 5-year-old children who told us that they would rather die than continue living. We were doing drawing sessions for children. They drew the scenes of their entire family being killed. They drew bodies of their mothers with a leg on the side or an arm on the side. It's just gruesome. Is there a coping mechanism that you can give children who've lost everything and they don't know where to go, they don't know what the future will be, there is no schools left, they've lost their entire family, they don't have shelters, they don't have anything left. Nothing will provide relief, nothing will alleviate the suffering but a ceasefire. The first thing we need to provide humanitarian support is a ceasefire.